Today we're taking a deep dive into something pretty interesting.
Oh, yeah.
Positioning head tilt in cats with myasthenia gravis.
Yeah, PhD.
You shared a study with me
Did.
from the Journal of Feline Medicine and Surgery Open Reports that explores this connection through two unique cases.
It's a fascinating area because, you know, PhD isn't something that we commonly associate with MG. And so this study really delves into whether it might be a more prevalent clinical sign than we even realize.
Right. And the study really focuses on this potential link between MG and dysfunction of those tiny sensors in our muscles called muscle spindles and the resulting head tilt.
Exactly.
So let's unpack these two cases.
Okay.
The first one involves a 1-year-old male domestic shorthair.
All right. So he presented with kind of this classic cluster of MG symptoms.
All right.
Decreased appetite, tiring easily, droopy eyelids, and of course the PHT.
Right.
The standout finding, though, was a significant amplitude attenuation on repetitive nerve stimulation testing. This, combined with a positive edrophonium test, really strongly supported that MG diagnosis.
Interesting. The second case involved a 9-year-old female domestic shorthair who developed PHT after recovering from pleural effusion.
So in this case, the cat had a positive acetylcholine receptor antibody titer, which is suggestive of a possible thymoma.
Interesting. So despite the different presentations, both were diagnosed with MG.
Exactly.
Which begs the question, could the PHT be an early indicator of MG?
That's the burning question this research is aiming to explore. They hypothesized that the mechanism behind PHT in cats with MG might be similar to what's seen in cats with hypokalemic myopathy. Specifically, dysfunction of the muscle spindles in the neck muscles.
So for our listeners who might not be familiar with muscle spindles, can you explain their role?
Certainly. So muscle spindles are these sensory receptors that are found within skeletal muscles. And they provide the brain with this constant feedback on muscle length and the rate of change in length. Essentially, they help the body to understand where it is in space, which is a sense called proprioception.
So if these muscle spindles aren't working properly, the brain could be receiving inaccurate information about the position of the head, leading to that characteristic tilt.
Precisely. The study suggests that in MG, the autoimmune attack on acetylcholine receptors could also be impacting the muscle spindles, leading to their dysfunction and contributing to PHT.
Now, the study does acknowledge some limitations. For instance, in the first case, there wasn't any acetylcholine receptor antibody testing performed. Although the other diagnostics strongly pointed to MG.
And also with only 2 cats in the study. The sample size is obviously very small. There was also no specific evaluation of the muscle spindles themselves to confirm their dysfunction.
So while this research offers a compelling hypothesis, more work needs to be done to definitively link MG, muscle spindle dysfunction, and PHT.
Absolutely. But it opens the door for some really intriguing questions about PHT as a potential early sign of MG, which could have a significant impact on how we approach diagnosis and treatment in the future.
Absolutely.
And this study also really digs into the neuroanatomy behind PHT, highlighting this crucial role of the cerebellar nodulus and uvula, often referred to as the NU.
Remind us what these structures do.
Sure. So the NU is essential for coordinating movement and balance. It receives input from the vestibular system, which tells us about head movement, and also from those muscle spindles in the neck, giving it information about the head's position.
So it's like a central hub integrating information to keep everything in balance.
Precisely. So the researchers suggest that when the muscle spindles are dysfunctional, as they suspect in MG, the NU might be receiving this faulty information about head position.
Interesting.
And this could explain why the cat's head remains level when looking forward, but tilts when turning.
Because the brain isn't getting accurate feedback to adjust the neck muscles correctly.
Exactly. The study also emphasizes that diagnosing PHT can be tricky. It requires a very careful neurological exam to distinguish it from other types of head tilts, like those caused by vestibular disorders or lesions in the central nervous system.
So it's a bit like detective work, ruling out other possibilities to arrive at the correct diagnosis.
That's a good way to put it. The study authors point out that PHT has been observed in other conditions too.
Okay.
Not just hypokalemic myopathy and potentially MG. For instance, it's been reported in dogs with cerebellar hypoplasia.
Which suggests it could be a common sign across different neurological problems.
Precisely. And the study stresses that relying solely on a physical exam might not be enough to diagnose PHT definitively.
Right.
Imaging, such as an MRI, can be crucial for ruling out things that might mimic PHT.
Okay.
Like brain tumors or inflammation.
So a combination of clinical observations and advanced diagnostics is key for getting a complete picture.
Absolutely. The authors acknowledge that there's still much to learn about the mechanisms underlying PHT.
Right.
Further research with larger sample sizes and detailed muscle biopsies would be invaluable for understanding the precise role of muscle spindles and the NU in this phenomenon.
This research definitely raises more questions than it answers.
It does.
But it highlights how even a seemingly minor sign like head tilt can be a valuable clue for uncovering complex neurological issues.
It underscores the importance of paying close attention to these subtle clinical signs and the need for collaboration between veterinarians and specialists, like veterinary neurologists, to ensure our feline patients receive the best possible care.
Yeah, it really does highlight how much we still don't know.
Absolutely.
About the feline nervous system.
Yeah.
But from a practical standpoint, what are the key takeaways here for vets and cat owners when it comes to PHT?
I think the most important point is recognizing PHT as a potential red flag for underlying neurological problems, including MG. It's not just a quirky behavior. It could be like this vital clue.
So if an owner notices this unusual head tilt, particularly if it's accompanied by other symptoms like weakness or difficulty walking, a veterinary visit is definitely warranted.
Absolutely. Early detection is critical. And for veterinarians, this research reinforces the importance of considering MG as a possible diagnosis when they encounter PHT, prompting further investigation with appropriate diagnostic tests.
And as we've discussed, a thorough neurological workup is essential to rule out other potential causes of head tilt, like those vestibular or cerebellar issues.
Precisely. It's about carefully evaluating all the pieces of the puzzle. To arrive at an accurate diagnosis.
And for cats already diagnosed with MG, monitoring for PHT could be helpful in assessing disease progression or response to treatment.
Exactly. The more we understand about PHT and its potential connection to MG, the better equipped we'll be to manage these complex cases effectively.
Well, this has been a truly fascinating deep dive into the world of PHT in cats with myasthenia gravis.
Absolutely.
It's remarkable how such a subtle sign can hold so much clinical significance.
What's truly exciting is we're constantly learning more about the intricacies of the feline brain and how these discoveries can directly translate into improved care for our feline patients.
It's a testament to the power of scientific inquiry. And the dedication of veterinary professionals. Who are constantly striving to enhance the well-being of our beloved companions. From Vet NeuroJar. Keep those minds inspired.
To have hearts loud.
And tails wagging.
Absolutely.